Every disease has a footprint in the family and in the community. Every individual belongs to a certain home as a member of a certain community. The reason it is important to have community health volunteers is that will be the first contact with a health service provider.
I'm Eurydice Gatweli. I work as a CHV, that's Community Health Volunteer. I have a passion of working as a CHV.
Community health, we call it level 1, and that is where the basic care of the care is solvent.
We must appreciate that community health is very key. That level 1 services is very key if the county, the country is to achieve the results of good health.
The role of the CHV in the community is to go around their households to map up of some of the diseases in the community, sensitize the community on various diseases, mostly TB, HIV, and also referrals for ANC, on the pregnant mothers also to check if they are going to the clinic. If they are not going to the clinic, you refer them.
A community health volunteer is somebody who has already been trained in certain health packages that they are supposed to roll out within the community. And it is very easy for a community health volunteer to pick up an abnormality in an individual because they visit them every day in their homes. And that individual can be directed to a health facility for management of their conditions if they are picked early enough.
These are the managers. They manage these big services at the community level. If these basic services are not offered at the community level, they will end up in a level 2 or 3, which is the dispensary or the center. And this will overwhelm the health care providers at those levels. So the community health frontiers are key in health system.
Good morning, madam. How is you? I have come again for checkup and seeing how you
I personally am always set. When I wake up, I first prepare my kids, go to school, I clean my house. I must have a kitchen garden as a CHV. I have to attend it. And then we set ourselves to the outlet shop with other CHVs that we may plan the day's activity. We have to work 2 hours per day on daily basis, Monday to Friday. We start our day here. We come here, we set ourselves, and we ask ourselves, what lesson, what are we to cover in the community for that day?
I program myself on the day that I'll go out. So I start early in the morning at 8, so that I can cover at least 5 to 10 households. I go check if there is any child under 5 years. Is the child fully vaccinated? Is the child taking the vitamin A supplement? Is the child growing well or not? If the child has not grown well, is not growing well, I still refer the mother or educate the mother on how to feed the child. If it is the issue with nutrition. And if I see there is a problem with the child growing up, I refer the mother and the child to the nearest facility.
When the community health volunteers visit these homes, they not only look for disease, they also talk about health itself.
Some of the challenges we met in our community was the issue of our health. Almost every person was complaining. If not blood pressure, it was diabetes. It was maybe the knees, the back, so many issues. That was the most challenging issue that we met as CHVs. And that is why we ask ourselves, for that challenge of health, nutrition, they don't know what to feed, what not to feed. Expectant mothers, some were underweight. They were not even feeding well. So when we realized that kind of a challenge, that is why we said the products that will be in our shop, or them that has calcium, zinc, iron, maybe potassium that will help us. So that was the most sensitive challenge of our health, nutrition, and fooding group.
I take time because maybe a household has 3 people and all of them want you to listen to them. So I can take almost 30 minutes in one family. In every household I go, I must screen them. Are you coughing? For how long have you been coughing? If there are any symptoms, I refer them for screening of TB in the CCC clinic, which is also where I'm linked.
It was very challenging to let people know and understand the cassava in your farm can be processed and you take it in another form, added value, and maybe which we were calling food security. But then we said as CHWs, we have to do it practically. So from the feedback we got from the community, help us to know with the food they have from the farm, if added value processed and in this form can help them. So the community started embracing the new idea. And so they started preaching by themselves. I took the products from the CHWs, my back is well. I took the pollen, my child is doing well. So that is what challenged us, and it also motivated us. And when we brought them, the community are coming for them. I need the calcium, I need the zinc, I need iron. So it's even motivating us.
The community health volunteers in our county, they really play a big role. Because what they do, they educate the community on disease prevention, they mobilize communities to be able to uptake the services, and that way we have an improved health-seeking behavior.
It is possible to decongest the number of people, very severely sick people, showing up in our hospitals if they can be detected very early before the disease overwhelms them. So for me, it's a big game changer because the community participates in its own health.
It's one thing to have health facilities available with the medicine and all the resources to one's health. And then there's also another different thing for the person, the community level, to one feel unwell and then make a decision in a timely manner to seek help. So that timely seeking behavior for health services makes the big difference. So when the community is educated, they are mobilized, again they take action. However, you can't achieve health by just the government providing health services. The community themselves, they are the determinants of whether they will remain healthy, whether they will prevent diseases. So the government becomes an enabler.
We have coordinators for the sub-counties all the way to sub-location and community level. So I oversee all activities as pertains prevention matters in the county. We have 138 community health extension workers. We have 34 community health assistants, and then we have 1,265 community health volunteers within that spectrum.
What makes a good volunteer is, one, it must be a calling from the heart. That even before you volunteered in the community, through the government, you are doing something for the community, helping the poor with the little that you have, taking someone to hospital, you don't have even a coin. So that one comes from your heart. No matter the situation, that one will make you the best volunteer in the world, not even in Tharaka Nithi County. It is from the heart.
If there are people that have a lot of security and confidence in CHWs, one thing, me working as a CHW, I must be very responsible because the information I get from my client should be known by no other person apart from me and my client. It was like a oath. Any information from your client, may it be a disease, may it be what, work on it by yourself and the client. So after a year, the community gained confidence in ourselves because the information they gave us however much it was deep, they never heard of it. So with that one, they gained a lot of confidence. By the way, they share more to us even than anybody else.
Trust is very important to the community. If they don't trust you, you're in danger. They trust me so much. Even for the vaccine, this is the COVID-19 vaccine, most of them waited in the house to hear from me. If I tell them it is okay, go and get it, that is when they woke up and went to get it.
If there's anybody who is proud and passionate of this work, it's me. Almost every 2 months, a team of CHWs from other places are coming to benchmark what CHWs from this place are doing.
In 2016, we had a serious cholera outbreak. In 2018, when we revitalized the system and increased the workforce, we haven't witnessed any form of such outbreak, unless the one we're having for corona, which is global. It is affecting each and every person within the globe. And also, on utilization of the healthcare systems, the facilities, we have seen a great increase when CHWs have been sensitizing our communities. They have been coming for treatment within our facilities, thing that we have not witnessed for the last few years.
The world that I would like it to manifest is a world free of diseases, these minor diseases, diarrhea, malaria, malnutrition, delayed growth of newborns, pregnancies that are not cared for maybe by the mother, going to the ANCs. I want to see a community that is free from common diseases that affect them.